Oh, okay, slight pause or shitty intro, but here we go. So, my name is Allison, and welcome to Walking with Warburg. My channel is going to be all about my journey with stage 4 breast cancer, which has metastasized to my bones. And I think it's important to share because it's not the everyday cancer journey. In fact, I am doing a self-prescribed metabolic protocol that I'm aware of, never been done in a clinical trial. There's been no human clinical trials to do what I am doing, and I see myself as a bit of a human guinea pig. There are other humans out there who are trying to do this. We work together in a small community, so hopefully this is going to be extremely educational for those who are doing this. And also, I'm hoping this will be enlightening to those who are also battling a cancer diagnosis, either of themselves or of a loved one. So my journey began in January 2023 with my terminal diagnosis. My oncologist had said there was nothing I could do from a diet and lifestyle perspective that would improve my outcome. That left me scratching my head. Like, how can this doctor be the only doctor in the world that says what you do in terms of your diet and your lifestyle, like how it won't have a health impact and affect my cancer? So that got me online looking at, what I should be doing, because they had given up on me. Any stage 4 cancer diagnosis, like when you're terminal, they give up on you. There's really nothing they're going to do to try to save you. All of the evidence is that it is uncurable. So they don't try, right? If you want to live, it's you who has to put the effort into figuring out how to do that. And that's a choice you have to make. You can either believe that there is no cure, and you can accept the treatments you're given, which they've stated are not curative. Or you can look outside the box. And yeah, I cried for like 6 months. I mean, I was told I was going to die. I have 2 children. Even if I didn't, who wants to die? And so, yeah, I cried. I cried for 6 months. I was a slobbery, snotty mess. But eventually, I could get it together enough to be like, well, what am I going to do? Like, what now? And the treatment I was put on, which was great. I'm not anti standard of care. I'm not anti medicine by any means. I just think there is a time and a place, and that we're not passive participants. We should not be passive participants in our healthcare. We need to be at the very front, especially now that medicine is so complex and there's so many different specialists. They really are in these small, specific trades, and there is no one managing all of that information and communicating between them. That has to be you, or I don't know what's going to happen. But I mean, we know millions of people are dying every year from cancer, and it's not getting any better. We've made no major scientific headway in 100 years. 100 years we've been working on this, at least, and trillions of dollars have gone into it, and we are still just doing surgery, chemotherapy, and radiotherapy. There is now, some hormone therapy, there's some new immunotherapies, but really nothing major has changed in 100 years. And I feel like we have to try something different. Like, we've been barking up the wrong tree for too long, and now it's time to try something different. And so when I was diagnosed and I realized that nobody else is going to put effort into this for me, except me, then I had to step up and take that role. And I just started doing research, more research, more research, and I came across Thomas Seyfried. If you have not heard of Thomas Seyfried, now is a great time to hit pause. Go look him up. He is a professor, educator, scientist running a lab at Boston College, and has been enthusiastically talking about the mitochondrial metabolic theory of cancer for so long. And he's on to something. Like him, many scientists around the world, not to take credit away from anyone, there is something changing, and people are starting to acknowledge that cancer has a huge metabolic component. Seyfried's theory is not saying that there isn't genetic changes occasionally within cancer. What he's saying is that is not the primary cause. The primary cause is actually dysfunctional mitochondria, and that those genetic changes are a downstream effect. And after spending 6 months diving deep and studying every paper I could find, I ultimately decided to do this. It's self-prescribed, which means I do not have a doctor helping me decide what nutraceuticals and what doses, how to implement this. It all had to be extrapolated from the science. Seyfried and his team are very descriptive, but they are not prescriptive. So I've really had to take it upon myself to work with other people, reach out to other people, read the studies, and put it together. But I am now on a therapeutic ketogenic diet. I do hyperbaric oxygen therapy. I combine that with many prescriptions, nutraceuticals that help to lower my glucose. And then I intermittently introduce a glutamine inhibitor. This protocol addresses cancer's metabolic needs in terms of how it fuels itself. Every cell in the world needs nutrition. Every cell in the world needs some source of fuel to live. And so the mitochondrial metabolic theory addresses the two fuels that feed cancer. That's glucose and glutamine. Seyfried's research clearly shows that in the absence of glucose and glutamine, cancer cannot ferment fatty acids. So getting on a ketogenic diet is very therapeutic. And there is a lot of evidence to show that it can decrease your chances of getting cancer and slow down the progression of cancer. Anyway, adding that to the science around hyperbaric and then a glutamine inhibitor, I was successfully able to take my 11 centimeter breast tumor from 11 centimeters to completely gone. I did that starting September 24th, 2023 was my first dose of a glutamine inhibitor inside a hyperbaric chamber while I had maintained a therapeutic state of ketosis. And by December, my PET scans showed my entire tumor was gone. I've since been working away, trying to get rid of the cancer in my bones, which I've struggled at. I've bounced back and forth between having remission to having some progression. But I think it's important to share everything I've been going through on a day-to-day basis so people can learn from me. And diving into YouTube is a bit of a new thing, although I do have a blog, and that was how I initially started, documenting every little tiny thing I've done. I've been doing this for over a year, and although there are many people now trying this, I think that I have overall a lot of experience and a lot to share with people. I've made a lot of mistakes that hopefully others can avoid by listening to my story and what I've gone through. In that blog, I also have a GoFundMe because this has been very expensive. Now, I have reduced the cost significantly, but it is still extremely expensive. And my goal with having that blog and my goal having that GoFundMe, isn't it just about like a source of money so I can afford to do this therapy? It's also, well, of course it's so that I can do it. And of course I want to live. Like of course I want to live, but it's gotten so much bigger than that. And it got so much more than just me so quickly, because I realized that even though I was diagnosed with a terminal disease, and as horrific as that is at any age, but especially as someone who's a bit younger, I haven't had that chance to enjoy my life. I'm not 80. You know, I was diagnosed at 44. So yeah, I want to live, but I want everyone else to live too. I want to contribute to cancer research in a meaningful way. And although this is the worst thing that's ever happened, it does put me in a position that others don't have. Other people don't get to donate their body to cancer research in what I feel is really meaningful. I don't want to just participate in another clinical trial for another drug that really is not going to do anything. Yeah, great. An extra 2 weeks of life. Thank you. Right? That's not what I want. I don't want another 2 weeks. I don't want another 2 months of life. I want to have meaningful extension. I want a cure. And if what the mitochondrial metabolic theory can offer is anything close to that, and they can't get a human trial, then I'm going to self-prescribe it and I'm going to become a human trial and I'm going to document it for everybody else. Because if this works and I've gone public, I feel like they can't ignore it. So I've been documenting everything. I take my blood twice a day at a minimum. If I don't have a continuous glucose monitor on, I document all of my macros, everything I eat, my exercise, all of it. And I'm hoping that no matter the outcome, that documentation I provide will get used to either prove some efficacy of this or put it to rest. But I don't want to sit by passively and die. And I don't want to see us continue to throw years and years and years and trillions of dollars at the somatic mutation theory and treatments that come out of that thinking. I think it's time that we do something different. And so that is what this channel is going to be. It's going to be me sharing my daily struggles and successes. I'm going to try and be as honest as I can, but know that Google, YouTube, and many online social media sharing sites have rules around what you can and cannot say. And I'm not a doctor, so I can't tell people what they should do. I don't even know how far I can go with telling you exactly what I've done without YouTube saying that I am perpetuating false information. So I'm going to occasionally choose my words wisely, I'm going to tell you what has been prescribed by a doctor, and I might have to be a little bit maybe more broad with my language when I'm talking about things I've done to myself with my own, my own choice to do to my body. That's something that's not self-prescribed, because I don't want it to come across as if I'm suggesting anybody else do it. This is 100% something that's been done on mice, and I'm just gonna do it to myself. I have been doing it to myself. And my initial breast tumor is gone. I did not have surgery, chemo, or radiation. I simply did the mitochondrial metabolic. I did a ketogenic therapeutic treatment, and I included a press pulse element where I'm leveraging what Seyfried has proven to be cancer's fuel sources, so glutamine and glucose. So managing those two macronutrients, putting metabolic stress on the cancer, and combining that with hyperbaric therapy. So that is my introduction. That is what this channel is about. It's putting myself out there, live or die documenting it. And I really hope that for those of you who are joining me, you are learning from my mistakes and successes. And it's opening your mind to the fact that the somatic mutation theory is just that. It's just a theory. And I personally believe it's long overdue to try something new. And that's what I'm doing, is trying something new. So join me in future episodes. Yeah, thank you so much.